Hi there, how are you doing today?
Hi, I'm doing well. How are you?
I'm doing well, so if you could for us, please just introduce yourself, give us your name, your title, a short bio about yourself, your credentials, and then state the title of your article, please.
Okay. Hello, my name is Jenny Pappas. I'm a family nurse practitioner and I also have my doctorate in nursing practice. I'm an assistant professor at Austin Peay State University, and I have about 10 years of nursing experience and about 8 years in nursing academia. My research efforts have included studies on provider education, and then also initiatives on to improve women's sexual and reproductive health. I'm a member of Sigma Theta Tau, the American Academy of Nurse Practitioners, and the American Holistic Nurses Association. I also serve on the American Holistic Nurse Educator Approval Committee, and the title of our article is Hypnosis and Pain, and that was written alongside Dr. Deborah Rose Wilson and Rachel Taylor.
Amazing. Well, thank you for sitting down to talk about this article with us today. So, first off, could you just briefly give an overview of why nurses should read this article?
Yeah, I think as nurses, we've all encountered someone probably daily experiencing pain. And it's actually affecting about 20% of our current population, and it's the most common reason patients seek health care from a provider. So I think this is so important, and we're always looking for tools. How can we do this holistically? And I think that's just because we've all seen the effects of the opioid epidemic. The American Nurses Association encourages alternative approaches to treating pain, especially exploring those alternative pain management options. So this article really provides some great tips for some therapies to have kind of in your nursing toolbox to help alleviate patient suffering through more natural or alternative therapies.
Awesome. So, this is a very interesting topic because I feel like not a lot of people have touched on this specific subject before. So, what made you want to write something like this on this very niche section of nursing?
Yeah, I think the research is really growing on evidence research for hypnosis and just natural remedies in general. So for me, working as a nurse during the opioid pandemic, I've really seen the crucial impact it has had on our patients, providers, and even the patients' families and providers' families. It's also created an economic crisis. So it's some research is saying it's cost us up to $630 billion annually. So I think this is just really important, and like you said, it's not out there enough. So I really think the research is there now. So we need to get just more awareness out about it and how we can help patients with these treatments that are non-pharmacologic, because I think that's great, and overall there's less side effects for our patients, and ultimately it can help them.
Amazing. And so, with this being such an interesting little niche topic, it probably could be overwhelming for nurses who are reading something like this and have no idea sort of anything about this. So, if you could tell them two to three things specifically that you would really want them to latch onto, or if like something they would want to get out of this article, what would those two to three things be?
Yeah, I think just to be aware of the growing body of research for these various complementary therapies, anything from acupuncture to massage, meditation, mindfulness, biofeedback, yoga, and then hypnosis, which this article highlights. But just to know that these things do provide effective evidence-based pain management, and just to keep those in mind, like I said, keep them in your nursing care toolbox as an option you can offer these patients. And I think also just know hypnosis specifically, and the article goes into it a little bit more, but it can be used for so many things. The research has found it effective against stress management, depression, anxiety, post-traumatic stress disorder, cancer, and even the treatment of cancer, irritable bowel syndrome, chronic pain, and other conditions. So this is treating a variety of conditions, and I think the research is really exciting on it. And the last thing I would say is nurses can actually get certified to be certified in hypnosis. And if you're interested in that, just make sure to review the scope of practice in your state, and make sure just to talk to other nurses who are practicing, because you want to make sure to choose a program approved by a professional organization. And some examples of that are the International Hypnosis Association or the American Society of Clinical Hypnosis. So those are some options if you're really interested in getting certified. But if not, just knowing about it and knowing it can be effective and the evidence is growing and it's there, I think it's really great for nurses to know.
Awesome. Well, Jenny, thank you so much for sitting down to talk about this very interesting topic with us today. We really appreciate you writing the article for American Nurse and to sit down just to talk about it a little bit with us.
Awesome. Well, thank you. It was great meeting you, and yeah, thank you so much.